All right, so go ahead and introduce yourself for me.
Okay, my name is Nia. I am 48 years old, originally from the UK, and live now in the US here.
Wonderful. So how long have you been a patient here with Dr. Lapenski in Advanced Spinal Care?
I've been here now about 6 weeks, I think, from the end of March.
Okay.
Middle of March,
Okay.
I'd say.
So what brought you in to see Dr. Lapenski? What have you been through?
So I've been dealing with symptoms for about 2.5 years. It started with a one-off vertigo attack that I had just sitting on the couch, but that attack came on with a head movement. And then I had, since I woke up with, like my senses had been dulled. I had vision issues, blurring in my right eye only. I had hearing issues, popping, and my ears trying to equalize. And then eventually I started to have facial pain, and I had some trigeminal neuralgia. Atypical trigeminal neuralgia is what I in the end got diagnosed with, which was excruciating pain across the right side of my face mainly, concentrating around my upper gums and my teeth, the side of my nose and around my head here, and my ears at the back here. So I was in a lot of pain, pain that narcotics didn't work. It was neuropathic pain, so it's just like burning, shooting pains, pretty much throughout the day, and that went on for months and months.
Wow.
And then I tried, over the last 2 years, I had tried physical therapy. I had tried conventional chiropractics, like 5 different doctors.
Wow.
I'd been through naturopathic doctors. I'd done elimination diets to see if it was an allergic thing.
Right.
I had tried everything. I'd been to neurologists, neurosurgeons. I do have an issue now with my upper spine, and MRI did reveal that. I have severe stenosis and flattening of my spinal cord there, which led me to NUCCA. In fact, my mother in the UK sent me a link about NUCCA and said, you have to try this because it's proved that, you know, with trigeminal neuralgia, it's actually helped a lot of people. And I did put it off for a while because I think I was in a little bit of therapy fatigue.
Yeah.
I had tried so many different things.
Right.
And eventually, you know, I came in here. It was like my last resort. I just felt like I had nothing to lose. I had no idea they were here. And I feel so fortunate to have found the doctors here.
Yeah.
From the first adjustment, my pain went away the next day for 3 whole days, which, considering I've been in pain 24/7, you know, for
Yes.
months, was amazing. I had like a 3-day milder. Everything is milder than when it did come back. Then it went away again for another 5 days. And then I got readjusted because my atlas had slipped, because I've been in this position for a very long time.
Yes.
Probably decades, we think.
Wow.
And it's probably what's caused all of my problems.
Wow.
And after that second adjustment, since that night, I have had, I think it's 20 days now, where I'm practically most days, I'd say 15 of those days have been pain-free.
Wow.
Nearly pain-free. I'd say it's a 1 or a 2 compared to the 10 I was when I came in.
Wow.
And the rest, my bad days, which aren't that bad anymore, they would have been my great days
Yes.
before, are now like, you know, I'd say they're a 4 or a 5.
Wow.
And I just feel like I'm getting better and better. My sleep's improved. And most importantly, my relationship with my kids have improved.
Oh, wow. Amazing.
You know, I wasn't able, because it was mouth pain.
Yes.
It used to hurt to talk.
Yes.
So I really did try to not speak, which obviously
Yeah.
I've got over that now.
Yeah.
But I wasn't able to read a bedtime story for my
Oh.
8-year-old son, and now I can again.
Oh.
And it's just little things like that, because people with chronic pain know that how it affects so many of the little things in life. Not just the big things. The big
Right.
things you can cope with. You kind of get over that. It's the relationships with your kids and your
Yes.
family and the everyday stuff that
Yes.
people take for granted that you just can't do. Now I can. So
Wow.
thanks to NUCCA.
Wow, that's amazing.
Yeah, yeah.
So this was really a last resort.
Well, it felt like that. I mean, to be honest, I was ignorant. I hadn't heard of NUCCA, in all honesty. My mom sent me the link, and I was like, okay, I'll keep it and I'll think about it. And I worked on, I took a lot of supplements. We've all been there. What's my diet. I did everything right. Yeah. Everything else right. And this was like the missing link for me.
Wow.
To getting, I don't know if I'll ever get rid completely of trigeminal neuralgia.
Right.
I'm not claiming this is a cure, but what I know is in the time that I've been here, my pain, I got my life back.
Wow.
I've got my life back. So.
And for many people with this, as I understand, this type of chronic pain is some of the worst chronic pain that you can experience. Yeah. It's like an ice pick.
They call it suicide pain.
Wow.
In fact, it's referred to by some people as the suicide disease because I don't know what the percentage is, but a certain percentage of sufferers actually commit suicide because you cannot get away from this pain.
It's constant.
Yeah,
it doesn't end.
You can't take medications. Well, you can take medications. There are medications out there, but to be honest, I just didn't want those side effects, and I felt that was going to impact on my health.
And
further down the line.
These are medications that you wouldn't be able to drive with. It does limit still what you are able to do.
It didn't seem to make any sense to me because those side effects would have been as bad as quite a lot of the symptoms I was having. Right. There's no guarantee they're going to work. Right. And I just wanted to try everything else first. Yes. And I'm glad I stuck that out and did this and found this.
Amazing.
Great. Yeah.
And have you been able to speak with any of the doctors or people that you've been in contact with previously? Yeah.
I mean, I've spoken to my doctor who had referred me to another doctor to do with. I'd had my atlas adjusted before using another method.
Okay.
It did not work.
It didn't.
It did not touch this at all. I had no results. I know that method might work for some other people, but it did not for me with this. With this worked. And I've tried, I've been everywhere, believe me, I've tried everything. Wow. I've had acupuncture. I mean, I could go on and on. The list is endless about the things I've done.
Yeah. So if somebody else help me with this, trigeminal neuralgia.
Trigeminal neuralgia. I have atypical trigeminal neuralgia, which means my pain is constant. Okay. Trigeminal neuralgia is, the pain is not constant, but they have more like lightning strike pain.
Oh yes, okay. Yeah. So if somebody was experiencing this and they've tried almost everything and they're losing hope because this is such a hard disease to deal with, what would you tell them about NUCCA?
Do this. Don't waste time. It is worth every cent because I know there's a cost to everything in life. And when people spend time and there's a scientific approach behind this, it is worth every cent. That's what I'll say, because I've wasted a lot of money unintentionally in the past, thinking you have to try things, and it didn't work. This worked for me. I know that, and it's been worth every penny that I've spent on it. So just go for it. Yes. You'll get your life back, and you can't put a price on that.
Yeah, absolutely. Well, thank you so much for sharing your story. There's so many
my pleasure
that will, I think, benefit from this and be willing to try this and see if this will work for them.
I really hope so.
Great.
Yeah, just
well,
go
thank
for
you.
It. Thank you.
Thank you.